woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hello, and welcome to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. Many opportunities for Shigella, Salmonella, E. coli, and hepatitis A virus contamination of human foods exist in agricultural growing, harvesting, processing, and packing. Pathogen vectors and pathways range from domesticated and wild animals to water runoff from nearby dairy farms and grazing pastures, to contaminated irrigation water and pathogen transportation via farm equipment. Another potential source of contamination that we'll be talking more about today is unsanitary agricultural field toilets and uses. This particular public health risk can lead to unhealthy conditions for field workers, widespread foodborne illness, extensive product recalls, and substantial economic impacts to the agricultural industry. Contamination of food crops in the field can happen when a worker touches food crops with unwashed hands, when food crops are contaminated by urine or feces excreta deposited in the soil, or when flies that are attracted to this excreta in the soil then carry the contaminants into the food crops. According to the CDC, the Centers for Disease Control and Prevention, much of this burden could be prevented with better science and prevention tools. Which brings us to the topic at hand. Today, we'll be discussing an innovative approach to preventing and reducing foodborne illness right here in Monterey County, the salad bowl of the world. Developed by the Monterey County Environmental Health Bureau, the Agricultural Field Toilet Inspection Program prevents food crops from becoming contaminated by ensuring that 1, field toilets are sanitary and convenient to use, and 2, there is plenty of clean, safe water for drinking and washing hands. Here to talk more about the first ever agricultural field toilet inspection program is Supervising Environmental Health Specialist, Ms. Susan Rimando. Welcome, Susan, and thank you for being here.
Oh, sure. Thanks for asking me.
Absolutely. So, Susan, this is a really interesting program. Why was this program established?
I just want to start that the law is not new. This law has been out since 1975. And all we did is we developed the program. We dusted off the old act and developed an inspection sheet. I gave you a copy.
Indeed.
And an application. And so that's why we say we developed the program itself. But back in 1975, I don't think you were born yet, Emily, but Cesar Chavez was an activist, and he wanted to try to help the agricultural workers with a lot of things. With one, their salaries, because they were low paid. They didn't have proper toilets to use. People died in the field from heat exhaustion, so he wanted to make sure that they had a supply of water. And he organized them. He formed the UFW, and he made it happen. So that's where we got the it was called the Food Harvesting Act. So what prompted us to shake the dust off is Monterey County had 3 foodborne illnesses, and it was all traced back to apparently produce that was grown in our county, and that was back in the year 2004. So when that happened, or when the outbreak happened, we didn't have the field toilet inspection program yet. My director, Alan Stroh, had said, Susan, the state wants to know if we can help them out with the investigation. And I said, okay, sure, but I didn't know where to start. I said, maybe if we walk through a creek that they suspected was the problem, maybe we'll find some interesting things. And so that's exactly what we did. It was a 7-mile journey, but a group of us took a walk in the middle of the creek, and we wrote down everything that we saw that could potentially be a problem. We saw things like cows sitting in the water, horses running across the stream, chickens, pigs. Even we saw a field toilet laying on its side in the creek. So we had our job cut out for us. And
there was a lot going on in that water, and kind of just behind the scenes is what you're saying.
Exactly, which the public doesn't have access to this particular creek. It's located behind residential homes, and so it's like at the hidden creek. And that's not the only creek in the county that has some issues. We'd have to walk all of them, but this particular one was the reason why we came up with this program. Because when I reported back, one of the things that I said was, and I saw a field toilet laying sideways in the creek. I didn't know if there was still contaminants or whatever in there. So I said, I think what we can do is to bring the field toilet program back, the inspections. And even one of my coworkers said, no, it's not going to work, because we tried it. I've worked in the health department over 25 years, and we had the field toilet inspection program, but we couldn't get out there to all the fields. Our cars were getting stuck in the fields. We couldn't locate them, so it just wasn't working. We turned it into a registration program and only went out when there was a complaint.
Okay, so it wasn't a routine.
Right.
You were just following the mandates that were, bestowed upon you from the state.
Exactly. We'd get a complaint, we'd know the location, we'd go out. So my coworker said, no, it's not going to work. We tried it. And I said, but we're going to do it the smart way. And so everybody said, okay, what's the smart way? Well, we, environmental health, we inspect the mobile food facilities, the lunch trucks that you see out there. And in the years past, it was kind of like our field toilet program. We couldn't get to them, couldn't find them. So by saying inspecting smart, we had the mobile food facilities come to the health department. We make an appointment, and they come to our facility, and then we'll take a day and we'll go out and find them and kind of randomly inspect them. So it's worked. So that's the same thing. And we use, and there's a sticker there.
I'll hold up the sticker.
This sticker we put after we do the inspection for the mobile food and the field toilets. When we conduct the inspection and they pass, we put that sticker in the left upper hand corner of the vehicle and also of the field toilet. The color coincides with the DEMV registration color.
Oh.
So we know year to year if that particular unit has been inspected.
Just by first glance? Okay.
And you could see it 100 feet away.
I've actually started noticing some.
Did you?
Yeah, since we've been talking. So
Good. Then it's working. Let's see, the other thing.
You were saying about how the field toilet program kind of was established by doing smart inspections the smart way, just like the food.
Exactly. So what we do similar with the mobile food facilities is that we go out to the yard. Some companies have like 1,000 field toilets. So we'll actually take a team, go out into the yard and inspect them, and then everybody's putting the sticker on. Now, the ones that aren't in the yard, we have their foreman or somebody actually drives out in the field. They know where all their toilets are, and then we do the inspection that way. Now, there's 8,000 field toilets in Monterey County.
Oh, wow, okay.
And we've already inspected 6,000 of them. So we've got our work cut out for us, and this is every year. If some of the yards like open up at 4:30. They want to get the toilets out to the fields by 5 or 6. Our inspectors are out there inspecting them.
5 or 6 in the morning?
4 in the
4
morning.
in the morning.
They
Okay.
want to get those toilets out to the fields by 5.
So you've got to inspect them first.
Mm-hmm.
Okay, I'm following.
Right. And so
when you, well, let me ask you, let's back up a minute. So when you said to everyone, look, we're going to do this the smart way, smart inspections. What kind of conversations were being had at the health department? Was it more like, how are we going to fund this program? How is this going to work out logistically? Is this appropriate fit for environmental health? Or what kind of barriers, if any, or challenges did you encounter, internally at the health department, or from, the agricultural community locally? Any pushback at all?
There was some resistance. Like I said, there was some resistance within, our own Environmental Health Bureau, but not really. It took us 2 years to think the whole process out about how we're going to collect the revenue, to go out, do the inspections, to develop the inspection report, the applications. It took a lot of time, but we did it, and we had a group, and we all worked really well together. So there wasn't any problem there. We did get some opposition, and just a handful of farmers that really didn't want us out there. Who wants inspectors,
right,
out on their property? But other than that, no, it was really great. Our director, John Ramirez, has done a great job, and a lot of outreach, a lot of education, a lot of public speaking. He would have meetings in different towns, and he stood up and he did great. But he got the program promoted.
Excellent.
Well.
So he went out and got feedback from the community, and really sort of heard their voices before it was, okay, this is what's happening now.
Right. The first year, the rollout was pretty soft. We went out and educated a lot more, rather than writing people up, with violations.
Right. And
there was a study that was done, and it showed that when we first started in 2007, when we first started, there were like 88% violations noted, mostly hand washing, no soap, no towels. Then in 2008, it was a drop to 76%. And then the following year, another drop to 53%. And now in 2012, there's very, very few. Even if they didn't have any soap or towels, the foremen have the supplies in their truck. So we haven't seen any issues. So our program is working.
Oh.
And I brought this. This is an example of what we used to see years ago.
It looks like an outhouse.
That's exactly what it is.
Okay.
They did get fancy, and they put a pipe here to allow the sewage to go, we don't know where, where it's
right
going.
On the grass, maybe.
But this was typical.
Okay.
And later on in the segment, you'll see what we're seeing out there now, and there's a tremendous difference.
Wow, so this is what you saw that fell over on its side.
This isn't the particular one.
But there's one like this?
Yes.
Okay, this thing is a little rickety. Definitely doesn't look clean.
No.
Like you said, the runoff looks like it's going nowhere, or right there into the grass.
Right.
And this, perhaps it's a cooler right here. It looks a little rusty.
It does. Would you like to drink out of that?
Not today, not today.
So we've come a long ways, but the companies that are out there now, they have, beautiful units.
And so tell me about that, though. Does the farmer, the owner of the farm, the owner of the field, do they buy these so they own them, or do they contract with a company that provides
Some do.
the mobile facilities?
Some own their own, but there's quite a few companies out there that have thousands of units. And they take the unit out to the field, and then they bring them back in to clean, or they'll clean in place. They won't clean in the field, but they'll move it to the side and do a thorough washing and fill everything up.
So who has to hold the permit in that case? Is it the owner of the toilet, the field toilet, or is it the whether that be the farmer, or is it the company that owns the field toilet?
It's whoever owns the field toilet.
Okay, so
They're
it may
the
not, the
permit
responsibility may not fall on the farmer.
No.
Okay.
But when the field toilet's out there in the field, the supervisor, he's responsible to make sure that there's supplies met.
Okay.
That there's adequate water, there's toilet paper, there's soap.
Very interesting. So, Susan, I just want to kind of recap some of the very early, like, contextual issues around the implementation of this program. You've given us an excerpt from the California Health and Safety Code. I don't know if folks can see this, but it's dated 1975, like you were mentioning initially.
That's the original one.
So this is the original requirement legislation around the mandate to have field toilets available.
Correct.
So that started in 1975. You were inspecting field toilets in the 80s, kind of?
Yes.
And then after a number of foodborne illness reports and outbreaks,
yes,
there was the movement to kind of make this an official program, and that's where we have this.
That's correct.
Okay. I want to make sure that we've got our timeline kind of down so folks know.
No, that's correct.
Know when we're talking about what. Susan, I realize you're going to be around for the next segment, and so I want to thank you for taking the time to talk with me today, this segment, and I'll thank you for advance for sticking around for the next segment.
Sure, no problem.
But right now, we're going to take a short break, so don't touch that dial. We'll be back in just a moment with more of the Your Health television program.